Music has no boundaries.
Music unites us.
Pakistan Global Community.
चलता रहे ये कारवां.
Hey. Thanks to Pakistan Global Community, a platform fostering human relationships, unity and peace through music. Thank you so much, Ash and Syed, for allowing me to be here. This is Dr. Meenakshi Anantram, your own Smulian with ID, Raz Meenakshi. आप सोच रहे होंगे ये कौन है, ऐसी क्यों पहनी है, ये क्या है? I'm one of the few people who can wear this red nose and walk away because I am a medical clown. Check it out on Google, Baba. Medical clowns are support systems to doctors. We are actually the clown doctors, and my husband and I are India's first palliative medical clowns. It's a wonderful opportunity this month, the month of October, for us to all discuss breast cancer. It's more than 25 years that the month of October has been assigned to breast cancer, and rightfully so. So pink sisters, let's unite. I'm also wearing pink for the cause. And when I say pink sisters, it doesn't mean that this talk is only for the women out there. Do you know 7% of breast cancers in the world are suffered by men? Haji ha. You also have nipples, you also have small breasts, and men have suffered cancers of the breast. So don't think that only women have the prerogative to suffer this disease. Suniye meri baat. Cancer is the second leading cause of death in the world after heart problems. 10 million people die annually due to cancer. During the COVID, we thought the COVID was bad. But even during the COVID, 10 million people were dying of cancer, if not more, because of the COVID problems that we had at hospitals. More than 40% of cancers and cancer-related deaths can be prevented as they are linked to modifiable risks such as lifestyle. All of us know that. Quit smoking, eat less, drink more tea, have more turmeric, sleep well. Bolte rehte hain yaar, har din people tell us, but how many of us actually listen? But what is of interest to me as a medical clown and as a woman is that almost 1/3 of all deaths related to cancer could be prevented by routine checkups and early detection. 70% of cancer deaths occur in low and middle income countries. So what are we waiting for? There are 3 things. See the word cancer, the C word, like the F word, it's a bad word. See, but let C become courage, capacity to create opportunities to help each other. The breast, one of the most beautiful organs of the woman's body. I wish more women looked at their breast like the men do, always looking at the breasts. But look at your breast differently. We go to hospitals, we go to schools and villages and explain to the poorer people on how each one of us can actually check out our breasts. To examine your breasts, all you do is put your hand across and press. If you can find hard lumps, or if you find something that is troubling you, if you think you find something that is moving and not at one particular place, then you need medical help and need to go to the doctor. Many of us also do not know that when we take our breast examination, we can do this during our bath. Put your hand up and check your breast. Go around the breast in circular motions, or you can go up and down. It doesn't matter. If you find, because if you put your hand up, the cyst, if at all is there, will pop out. You'll be able to find it easily. Any pain, any swelling, any secretion from the nipple, or anything abnormal, back pain, continuous headaches, pain in the stomach, these are all reasons of irregularities. And if the breast is something that is troubling you, everybody will know that there is something wrong. You can lie down also and do this test, or sit up and do the test, but do the examination once a month at almost the same time. Those who are in menstruation, please wait 10 days after your periods are over and then you do it. Men, no menstruation, you can do it anytime. There are many things, many myths about cancer, especially breast cancer. And since I've been allocated very little time, I will go through that very quickly. The first myth: a lump in the breast is always a cancer. Not true. A lump could be an irregularity because of some hormonal problems, an infection, or just a cyst that is showing up. It doesn't have to be a cancer. Don't get frightened if you find a lump in your breast. Every lump is not a cancer. The second myth: male breast cancer. Oh, our men think they're above everything, isn't it? So sorry, brothers. Although breast cancer is more common in women, men can also develop breast cancer. In the United States, less than 1% of all breast cancers occur in men, especially fat men with fat around the nipples. So if you are bulky and you find that your nipples are troubling you, oozing or hard, go check it out. There are some differences between the male and the female breast cancers. If you want more details, please contact me directly. I will talk to you. Biopsy always spreads cancer. This is another myth. Sometimes biopsy is the only way, actually all the time, for us to know whether a lump is cancerous or not. So don't get frightened. Some people think by applying deodorants they get cancer, or by living a lifestyle that is different from others they get a cancer. But lifestyle is important because our body is made up of 40 trillion cells. Each cell in our body is capable of housing or becoming a rogue cell and becoming cancerous. There are many risk factors. Every day you and I have a risk to have a cancer in the body. All of us form cancers every day, but they're very small and they are benign. They go and rest in some place and they don't show up. Sometimes our blood vessels, by increase of oxygen, increase of sugars, lifestyle, sometimes just triggers naturally mutations. Some cells get rogue, and when they come into the blood vessels, blood becomes their partner in the crime and they start growing incessantly. So different parts of our body, there are more than 200 types of cancers, types and subtypes. Dr. Suman Das in Visakhapatnam from Apollo Hospital has been doing immense work, and I will share some links of his work and his papers and blogs. But there is a lot of truth. If you and I can stop, it is the second largest killer in the world, believe me. It is nothing simple. Breast cancer is also a big deal in the cancers, but you can save people by giving them awareness. Sometimes when we go to villages, we find 1%, and we are very happy. Ladies and gentlemen, time is coming to an end, but remember, life is very short. I thank Pakistan Global for taking this opportunity of spreading awareness to music. Every time you sing, don't just sing your song. Remember, life is a song. Zindagi ek gana hai. Please sing the right song at the right time to the right people at the right place. For us as medical clowns, we go to hospitals and we sit with terminally ill patients. We play with the little children, but our focus is on the parents because they do not know. They're in denial. So we tell them how to be ready to lose their child. When we lost our son to cancer so many years ago, nobody told us this pain. So we have decided to become Mumpy and Monji the clowns, and we visit hospitals almost every weekend. We sit with terminally ill little children. We spread awareness to the parents. You can also do it. It's one life, one chance. Remember, all of us come with expiry dates. Let us leave our footprints on the sands of time. Share your thoughts, ask those questions, and remember, we are available to you. Thank you, Pakistan Global, for this great opportunity. Shabba khair. God bless you. Have a wonderful, pain-free, happy, musical life. This is Raz Meenakshi, your own.